A very good evening, guys. Good evening, BPs MBBS. I hope I am audible, guys. Yeah, I will start within 1 to 2 minutes if people join, because as people asked, it's better to finish it over in the first session. So let's complete the Q&A. I'm not feeling so well today, so I'll just ask the questions and I finish this live as soon as possible. So tell me if you are ready. Please ignore the noises background because people are home, so all the noises are there. And let me know if you are ready for the questions. Beautiful evening. Yeah, Sudhanshu, good evening. Yeah, I think the cycle has broken after the 5 day gap I have got into. So my mom is taking me somewhere since 3 days every evening. So some things are not good to resist. So yeah, I'm going with my mom since 3 days, and also I don't feel very well today. I didn't want to do today's live session for 3 hours too. Is it useful, the 3 hours? And sometimes I have this feeling of whether the live sessions are actually useful. I mean, very less people are joining, and I am literally concerned because uh, with the facilities I have right here, I feel I'm hurting my back, and it's like okay. Then I'll try to do them from tomorrow onwards again. I feel my the ketchup is near, and I literally feel very weak and fatigued. So yep. Okay, then let's start, guys. Let's not waste our time in messages. I'll just stop the thing. Yeah. Okay. Let's begin, guys. I don't know what to ask also, because I haven't studied much today, but I'll try to ask whatever I have gained through today's study sessions. Hi Mrinal, good evening. then some questions will be repeated because you need to revise them, right? If you hear it once and if you forget, you will end up remembering nothing. So some questions will be repeated and some will be new. Okay. Then, can you tell me what is the difference between decorticate rigidity and decerebrate rigidity? Okay. Yeah. Can you tell me what tracks are involved in which one? In decorticate, what tract is involved, and in decerebrate, what happens? Yeah, decorticate is flexion and decerebrate is extension. You are right, guys. Okay. Yeah, rubrospinal tract and one more vestibulo spinal is also involved. No, no, you are right in naming the tracks, but Swati, it is not intact in decerebrate. Yeah, in decorticate, both of the tracks are involved. In decerebrate, rubrospinal tract is damaged, which lead to over functioning of the vestibulospinal tract, leading to extension. Okay, remember that both of the tracks are not okay in decorticate, and in decerebrate, only rubrospinal tract is damaged. Okay, then. Can you tell me, can you arrange the carriers, the vaccine transportation in an order? Day carrier, ice-line refrigerator, walk-in cold rooms. Can you arrange them if you know? Yeah, it is beta blocker, na? It is glucagon. Okay. Okay, Shelby. Just now, Shelby. No, no, there is no mnemonic needed actually. Yeah, it's very simple. Yeah, day carrier is the lowest. One is day carrier and then vaccine carrier. Day carrier is present in villages and vaccine carrier in subcenters. Okay, and then small and then large ice-line refrigerator, then walk-in cold rooms. Okay, that's how you arrange. Even deep freezer is you know just before. Walk-in cold room is the highest one, remember that. Daycare is the least and walk-in cold rooms is the highest. In between comes the other things. Yeah, walk-in coolers is the last one, like the highest one. Just do BTR, I think it is enough, and do more MCQs, especially PYQs. You will be sorted. The main Malampatti, ASA grading and all. Nope. Just remember 1 to 2 hepatitis B like that. Yeah, sometimes I do and sometimes I don't. Don't waste time, guys. Let's wrap it up with questions. Just I don't know what comes. Can you tell me what is the protein problem in hypertrophic cardiomyopathy? In HOCM, yeah, it's MHC defect. You're right, Shelby. Yeah, titin is in titin is in yeah, it is beta myosin heavy chain. Titin is in dilated. Yes. Alcohol causes which cardiomyopathy? So, yeah, just given the answer. Alcohol leads to which cardiomyopathy? Please. Then okay. Okay then. We revised everything here. Okay. Which subject do you want? Just tell me if you want questions from any particular subject. I'll try to ask from that particular subject. Pharma. Okay. In pharma and patho. Okay. Everyone wants pharma. Busy pharma. Okay. So, okay, some questions from pharma. Can you tell me how to, measure? What are the? I mean, how do you measure extracellular fluid? Extracellular fluid. Extracellular. Okay, I'll try to cover those subject, guys. So first, tell me. It's okay. First answer that I will. I will ask pharma. You can't tell the examiner that this is physio, this is not pharma, right? Try to answer. Yeah. Okay. Okay then. Some pharma question. Okay. Can you tell me what is the drug of choice for um, vancomycin resistant Staphylococcus aureus? Vancomycin resistant Staphylococcus aureus. Yeah, it's linezolid. If lungs are a problem in that patient, then what is the drug of choice? If lungs are the problem, like if he has any other, condition like COPD, like that, what other choice you will use? Yeah, it's daptomycin. Just confirm it, guys, whether it is linezolid or daptomycin, because I remember it as L for L. It is used in lung kind of conditions. If lung is involved, I'll just confirm it. Wait. I could remember 1 second. That is what, guys, it is linezolid, because L for L, because linezolid has better lung penetration than daptomycin. So just clear confusion over there. If it is not, then you can give daptomycin. Bipolar disorder in pregnant female. Valproate cannot be given now. I don't think it's valproate, and it's valproate or antipsychotics. Okay. Yeah, antipsychotics. Then okay, okay. So just don't. Yeah, I don't really feel very good, but yeah, we'll just do it for 15 more minutes and then I'll stop. It's okay. Yeah. Okay, then can you tell me? It's an OBG question. Once again, we are revising the maneuvers. Which maneuver is for pinards? I mean, what we'll do in pinards and what we'll do in low sets. Pinards and low sets. Knee, what knee? No, no. Lamotrigine and levetiracetam are safe, but carbamazepine is not, I think. Yeah, low set is extended arms, right? Yeah, great. Pinards is extended legs, guys. Extended legs, yeah. We'll keep our finger at the popliteal fossa, you're right, guys. No, love set is extended arms. Please correct yourselves if you have given any wrong answer. Can you tell me three maneuvers for after coming head of breech presentation? Three maneuvers for after coming head in breech presentation. Yeah. Yes. Burn Marshall. Yeah. Great. Yeah, guys, you covered everything. Yeah. MSV, Burn Marshall, and Brave maneuver. Great. Okay. Can you tell me where do you see FEX gene mutation? PHEX FEX gene mutation. And can you tell me some examples of enzyme inducers? Examples of enzyme inducers. That is not needed mini. It's completely fine if you don't know it. Yeah, it is hypophosphatemic rickets. Great. Very good memory power, guys. Yeah, it is for hypophosphatemic rickets. And then can you tell me what are the enzyme inducers? Yeah, tell me the drugs causing enzyme inducer. Rifampicin, great. Yeah. Rifampicin INH will not be. INH itself says it is an inhibitor, medico. So it is an enzyme inhibitor. It's not inducer. Okay. Yeah, except valproate. Yeah. Those many are there. I don't know, but yeah. Okay. Yeah. Remember that you are right. Invisible, correct? Never bite. Okay. All anti-epileptics except valproate and all anti-TB drugs except rifampicin. All anti-TB drugs are inhibitors, right? Oh shit, yeah, yeah. All anti-TB drugs are inducers except isoniazid, which is an inhibitor. Okay. All anti-epileptics except valproate. Okay. We once again revise this. What are the examples for zero order kinetics? Zero order kinetics. Yeah, very theophylline, theophylline. Great. Okay then. Can you tell me which cephalosporins are bile secreted? Which cephalosporins are bile secreted? So yeah, you're right, Shelby. Warfarin, alcohol, and lithium and phenytoin. Correct. These many are there. Tolbutamide, I don't know. Yeah, cephalosporin. I asked in cephalosporins invisible. Just listen to it. Cephalosporin. Okay. Cephalosporin and one more ceftriaxone. Correct. Yeah, I only remember four of them as an example for zero order. Ends with one. Okay. I think roll and all, there are five. I think maybe four. PCSK9 inhibitor, what is it? Evolocumab. Which one? Which one, Abhi? Okay, can you tell me? I'll just clarify it to you. It is in my choti copy. I forgot it long ago. MTTP is what I remember because Levitap. Somewhere. So, PCSK9 synthesis inhibitors, inclisiran is what I wrote. Yeah, inclisiran is correct meaning. Okay, PEX is Zellweger syndrome. Fox is NADPH oxidase. And PEX is rickets. Okay, great. Thank you, Shelby. Yeah, there are so many drugs now. Pramlinitide can be used. Yeah, even acarbose can also be used. Okay, then can you tell me anorexigenic compounds which can cause anorexia? Anorexigenic. It's quite okay. Yeah, even acarbose can be given. Can you tell me the drug of choice for mycoplasma? Drug of choice for mycoplasma. There are some compounds, guys, which are orexigenic and anorexigenic. So you have to remember either one. So like leptin, I will tell you some examples of it. Melatonin stimulating hormone, leptin, serotonin, norepinephrine, and someone has said it right. It is insulin. All these are some of the examples of anorexigenic compounds. Not directly asked, but they will give you, some lengthy question, and then they will ask. Yeah, Shelby. That is what I'm talking about. It's important to know. Many times asked. Okay. Okay, then. Very irritating. So hand-foot mouth syndrome. Hand-foot syndrome is caused by which anti-cancer drug? Yeah, it is macrolides. Yeah, sorry, I forgot. It's macrolides, azithromycin. Great, guys, for mycoplasma. Leptin, insulin, melatonin stimulating hormone, and norepinephrine. And serotonin. These can cause. Yeah, capecitabine 5 fluorouracil. Great, guys. Very nice that you remember all of those minute points. Great. Capecitabine, 5-fluorouracil. True. Then, can you tell me where else mitomycin C is used? Mitomycin C is used. In which conditions we use mitomycin C? We have only we have only 3 points to remember about it. Yeah, subglottic stenosis, great, and bladder cancer, great, and one more, many candidates. Yeah, terrorism, very nice. Here I am, nice. All those three, mitomycin is used. I mean, main important points. Every drug is used many conditions, but you have to remember 1 to 3, right? In mitomycin C specifically, only those three are asked, so that is why. Yeah, in eye terrorism, great guys. Next. So hyperstabilization is a mechanism of which anti-cancer drug? Hyperstabilization is a mechanism of which anti-cancer drug? Yeah, great Swati, you are right. It is for taxanes. Remember, yes, it is for taxanes. Don't worry. It is for taxanes. Okay. It's fine that you forgot. Pharma is like that, and you guys remember more than that. It is given in BTR only. Like ma'am has given it for hyperstabilization of the microtubules is by taxanes. You can check it out once. Nice. Uh, I don't remember. I'm just asking because I forgot entire pharma. I'm asking for you guys. I don't know. I think ma'am hasn't given here.
Can I go?
No. Go that side. Yeah. Okay then. There are some more questions I wanted to ask. I did one GT question. I just wanted to ask about it. Okay. Can you tell me? Okay. Yeah, I think Shelby is right. Okay. Can you tell me what are the ball and socket joints we have? Ball and socket joints. I know you will tell me shoulder and hip joint. Please tell me the other one. Yeah. 4 places. Tell me the remaining place. Yeah. Great guys. Incudostapedial joint and calcaneonavicular joint. Great. Nice. Okay. Then correct guys. Okay. Can you tell me what is the first sternocostal joint? First sternocostal joint. Which one? It is. First sternocostal. I think it is secondary cartilaginous joint. Please check it out. Secondary cartilaginous joint. No, I think it is secondary. Please check it once and let me know. Okay. Primary. Primary? I don't think so. Stop checking it out. Okay. I'm sorry. It's first intercostal joint only. Yeah, you're right. You guys are right. I'm just confused. It is first primary cartilaginous joint only. Okay then. Uh, I have some questions in my mind, but I don't remember it now. Okay. Can you tell me what is the order of muscles involved in thyrotoxicosis? Yeah, it is fibrocartilaginous, but it is primary, okay? It is not secondary. Great, I'm slow. Nice. Yeah, order. Order is what I'm asking. It is I am slow. Mrinal is right. And it is, I forget these mnemonics very easily. Okay then. Can you tell me what does the blue color indicate in that? What is that program? PMJ or something? Not PMJ. That one. It is thyroid muscles involvement. Thyrotoxicosis muscle involvement. Okay. Yeah, blue is PIH. Remember that. Yeah. We don't know the program, but we know the answer. Just know the program also, guys. And can you tell me what is the procedure of choice we do for a CTEV child at around 8 years? Yeah, PMSME. Okay, PMSME. Is it not? Why you deleted it? Okay then. Can you tell me what is the procedure or surgery of choice at around 8 years? Wait one second. Yeah, great. It is Dwyer's, guys. Oh, PMSME. Okay, doesn't make sense because we don't even see that. We see all the M and S. That is what we see. Okay. Yeah. Postromedial tissue release is for 1 to 3. Then 3 to 5 is that Ivan procedure, and then Dwyer's at 8 years. And then 8 to 10 years, what do you do? 8 to 10 years we use tarsectomy, wedge tarsectomy. And more than 10 years, what should we do? Recently asked actually. Triple arthrodesis, yeah. And we have recent procedures like, these external fixators like Joshi's. If you don't have any option there, please look for external fixators also. Yeah, it is triple arthrodesis only. Pikachu, my ID mark in prep or in which one? In marrow it is worse. In prep it was better. I don't know which one to answer for you. Okay. Uh, okay. I wanted to ask you what are the structures present behind the pterion? Important structures behind the pterion. Uh, it is 114 correct, Pikachu. Yeah, prep was easy little bit. Yeah, compared to marrow. Yeah, yeah, middle meningeal vessels. Yeah, lateral sulcus. Great, great guys. And yeah, Sylvian fissure. Nothing but the lateral sulcus. Why is lateral sulcus important for us? Not only middle meningeal, even middle cerebral artery meets through this lateral sulcus. That is why it is important. And also the basal ganglia. Yeah, you're right, Minnie. Middle meningeal artery. Yeah, it's spinosum only. Lesser wing of sphenoid for what? No, where we have male now, where mandibular nerve, then lesser petrosal, emissary veins, and A is accessory. No, yeah. Everyone is asking my GT score. Not good, guys. As she said, prep was easy. It was 114. Otherwise, it is 105 correct. Okay. Antibodies. Okay. Tell me what is the antibody for drug-induced lupus? Oh, not rheumat. Okay. Can you tell me Anka? Anka. Yeah. Anka and Aska. Anka we have P, right? P Anka and C Anka. Tell me separately. Yeah, antihistone. And C Anka vagueness, great. P Anka. Where do we see P Anka? Yeah, Aska is in Crohn's, great. Yeah, P Anka is MPO, Chuckstraws, great guys. Okay. What else? Antibodies. Anti-TPO antibodies are seen in. Anti-TPO antibodies are seen in. I don't know, Bianca is MPO, but yeah, okay. What are the antibodies present in Hashimoto's thyroiditis? Antibodies present in Hashimoto's. Antibodies present in Hashimoto's, guys. Anti-thyroglobulin is for which one? Anti-TSH is, yeah. I think Brinal is right here. Anti-TSH is for Graves and thyroperoxidase and thyroglobulin is for Hashimoto's. Please correct me if I am wrong, okay? And what antibodies do you want? Last one 1 week I was studying at around 6 to 7 hours, but now since yesterday I was not able to, not feeling too well. GM1, what is you're asking? Okay. For Guillain-Barré syndrome, GQ1B is for Miller-Fisher, right? Did I miss something? In GBS we have 4 varieties, right? Yeah. I will study first and then I'll ask. Okay. Okay, then it's 6 o'clock. Please go and study. I tried to cover the questions. Tomorrow I'll ask better. For that I have to study more. Okay. So get back and revise whatever you have forgot today, and then start with the new ones which you wanted to do. Okay. Okay then. Yeah, definitely. Thank you so much, Swati. Spinal cord lesions regarding what? Biochem, what do you want me to ask? OBG. Okay, some OBG questions. What is the investigation of choice for uterine anomalies? What every question, every subject we ask. Then I'll ask mixed bag only. This is not happening. Yeah. Okay. Can you tell me where do we see lambda sign? Lambda sign in yeah, 3D MRI or ultrasound, not HSG. Okay, not HSG. Just MRI or ultrasound we will prefer. And gold standard is laparoscopy. Prefer BTR. It is good medico. Trust me, it will work. Just do it multiple times. It is good in my view, Hrithik. Yeah, MRI more than 3D ultrasound. Okay. In which syndrome do we have both secondary sexual characters present and breast is present but uterus is absent. Uterus is absent, breast is present, secondary sexual characters are present. Where do you see this kind of prototype? Uterus absent. It is MRKH only. No, it is MRKH. MRKH will have female type of, female levels of testosterone, whereas the other one will have male levels, the androgen sensitivity. No, yeah, it is Mullerians. Great. Okay. Can you tell me what is the lifespan for copper T? Lifespan for copper T? Severe cold. Copper T, lifespan for copper T. 10 years, it is 10 years, okay. Can you tell me emergency contraceptives? Emergency contraceptives. I think it is 380 only. Multi-load is 5 years, yeah. LNG, Ulipristal. Don't tell me just the drug name. Tell me the doses also, which is important. LNG, 1.5, great. Ulipristal, how much? 30 mg, great. Good, Minnie. Then, good evening, Tintin. Hi, long time. Okay, great. Centchroman is the brand name for which drug? Tell me, Centchroman contains which drug? LNG 1.5, Ulipristal 30, and then Yeah, that is correct. Ormeloxifene, guys, not clomiphene. It is ormeloxifene. Don't forget. Okay, great. Can you tell me what happens to heart rate in pregnancy? Heart rate in pregnancy. Yes, okay. I have to revise it, that part. I only remember heart rate and nothing else. Just revise it one more time. Okay. Else in gynec. Okay. In postpartum hemorrhage, what is the most common cause of postpartum hemorrhage? Primary and primary postpartum hemorrhage. No, I won't say subject because you will be, generalized. You will prepare only that subject for that particular time, which is not happening. Yeah, uterus atony. It should be mixed bag only because you don't even know which subject will come in the exam. So don't take exam subject as a consideration. So just let it go like this. Okay. 15 placenta. Yeah, atony is the one. Yeah, second one is retained placenta. Correct. Okay then. So first, what we will do? What drugs we will prefer after calling for help and all that thing? Yeah. No, I have stopped it since 1 week. I will get back to it once I complete this ini mock. I didn't revise the prep ladder ini mock. I have to do it. Still 40 questions are left. Yeah, oxytocin, and then what should we give? What is the drug of choice? Not drug of choice. What drug we should avoid in asthma patients? In asthma patients, what uh, drug we use? Yeah, methogen carboprost. Yeah. Then what is the drug of choice for inducing the labor? Rupture of membranes. For doing that, what drug we use for inducing the labor? Yeah, maximum 2 mg. Great. And what else? Doses. Carboprost is 2 mg maximum dose. We discussed the contraceptive ones, and I don't think diroprost will be asked because ma'am haven't given it. If yes, please let me know. Okay. Yeah, Police, diroprost, even the main one, the main hormone, oxytocin can be used. And then what else? Police. Did we miss something? I feel like I missed something. Can you tell me what is the score for soft cervix? Soft cervix. What is the score given in Bishop score? This is important. Yeah, cerviprime gel. Yeah. I mean, there is a list of things which cause stripping of membranes, but I don't remember. I only remember oxytocin, diroprost, Police, and what else? Yeah, two. Great. Just go it through the Bishop score. They are asking to calculate. Okay, then posterior soft now. I think it is second one. Just posterior 0, then okay, then in gynec, the maneuvers, the drugs. Okay, PIH. What are the drugs for pregnancy-induced hypertension? Drug of choice for pregnancy-induced hypertension. conization is a procedure, dear. It is, you will cut the tissue. Colposcopy is not. You just, visualize. Yeah, labetalol, methyl dopa, and what else? For labetalol, it is 220, 200 or 220. And other than labetalol, what else we use? We have some N related drugs, nitroglycerine, nifedipine. Yep. Okay. Just go through it. When do we call it as pregnancy induced hypertension? When do we call it as GDM? Yeah, hydrazine. Okay. With L-dopa nitroprusside. Okay, great. After 20 weeks, yeah, 24 and 20. Okay. 24 we call it pregnancy induced hypertension. 20 it is GDM. No, it is 20 only, Tintin. I'm sure it is 20 only. Okay. Okay, then what we have? Okay. Can you tell me which type of pelvis is I forgot the question. In which type of pelvis the anteroposterior diameter is more? Anteroposterior diameter is more, and face to pubis delivery is related to which one? I'm remembering the questions, but I couldn't recall the answers except for this one. Yeah, anthropoid is AP diameter one. Yeah, correct. Not platypelloid. It's anthropoid only. No, it's anthropoid, guys. Okay. And you are telling for face to pubis. Okay. Can you tell me what else we have? Okay. This feeding vessel sign is a feature of feeding vessel sign. Feeding vessel sign is a feature of that is what I wanted to ask. Deep transverse arrest is for Android, I guess. Yeah, polyp. True. It's okay. You will know now. You can just go back and see where you are going wrong. Okay. Okay. I mean, what is the plane of least dimensions? Plane of least dimensions. Yeah, I am sick. Yeah, I will re-revise. Thank you. I forgot. Let me check it once here only because I don't recall it, but I know the question. 1 second. Yeah, face to pubis is anthropoid, guys. Deep transverse arrest is android. Both are correct only. Okay. And the plane of least dimension is S4 to S5. Okay. S4 to S5 to pubic symphysis. You are correct, Sai. S2 to S3 is greatest dimension. S4 to S5 is least dimension. Okay. Anatomical outlet is directly the coccyx, is what I has given. ma'am has given anthropoid. Please check it out and let me know. Re-revise, because ma'am has given it as phase 2 pubis is anthropoid. If I'm wrong, please correct me, okay? Greatest is S2 to S3, least is S4 to S5, and anatomical outlet is coccyx, okay? What, right, Mrinal? I didn't get you. Okay. Okay then. Can you tell me difference between complete mole and partial mole? Very confusing topic, but yet to be completed. Complete and partial. Yeah, I think so. Yeah. Tell me one or two is enough. Yeah. Yeah, okay. Partial D16 and X6Y. Fetus is present. Okay. Correct, guys. Most of them are present in partial and absent in this complete. Okay. No stem appearance. Tropical sprue, you have to give antibiotic. Trimethoprim and sulfamethoxazole is what we prefer. If I'm wrong, please correct. Okay. Where? Which one? Mini? So how can we forget the markers? Can you tell me the quadruple marker for screening? Quadruple marker. But I didn't see your question. Yeah. Correct. Okay. Okay, can you tell me which components are decreased or which components are increased here? Which components are increased? Yeah, anything having a H is high. Okay, great. I hope that's it for today, guys. We have maximized the limit so much. We have revised the gynec, just like that. So make sure whatever you have gone wrong, be revised just after this live, and then go to whatever you want to study. Okay, that otherwise this is of waste if you are not revising it. So probably do it after this session. Okay. No fixed time, but I'm doing it immediately after the starting of live for the convenience. I hope this session is useful to you guys. We'll try to do the maximum tomorrow also. No subject wise, but we try to, people are asking about path or pharma. We'll do that, okay? It's fine, because you don't worry about marks and study more. That is what I would say, okay? Okay then. No worries. Please go and study, guys. Just revise them one more time. Okay, bye bye. Yep, sure. Thank you. Thank you so much. Bye. Definitely, Swati will do this till the exam day. Okay, bye. Bye bye, PPs and BBS.